I am constantly amazed by the profound impact of sharing our struggles with each other. The one day at a time phrase helps us remember to pause. In a pulsating world, we often forget to pause. That's where One Moment Podcast began its journey, committed to nurturing mindfulness, change, and advocacy around the world, reducing stigmas associated with mental health, substance use, and suicide, and changing the way the world reacts to these taboo topics. Your voice of reason starts here. Founded by mental health professionals and agents for change, our mission is to offer insightful narratives that foster not just reflection, serenity, and insights, but to tackle the problems and solutions of mental health, substance use, and suicide on a global scale. We are making it our vision and mission to make a global impact on the mental health, substance use, and suicide crisis. It is easy to feel isolated and unheard, or like you're carrying your burdens alone. On the One Moment Podcast, we remind you that you're not alone in your struggles. There are millions of people worldwide who are struggling, and the weight of your experiences deserve to be understood. You deserve to be heard. You deserve to have a voice. The One Moment Podcast is a safe haven for connection. We have weekly podcasts. Join us to learn more about mental health, substance use, suicide, community initiatives, and much more as we tackle these global crises, creating change in the world. Change begins when we recognize there is a problem. Remember, change starts with you. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe to our YouTube channel, One Moment Podcast. If you would like to support us, you can find the links to donate directly to us on our official site, onemoment.chain.box. You can also support our sponsors. We are presently sponsored by W Energy, The Place to Heal, Mindfully Me Counseling, PLLC, Bright Life Therapy, PLLC, and WebHash. Check our official site for more information. Subscribe now. Some photos in this ad were created by Grok.
Welcome to the One Moment Podcast, ladies and gentlemen. My name is Kevin Odom. I am a licensed clinical mental health counselor, licensed clinical addiction specialist, and a certified clinical supervisor, all in the state of North Carolina. We have a very special guest here today on our show. I'm going to let him introduce himself, and then we also have another special person who is going to be joining the podcast. Absolutely looking forward to the experience that she brings to our podcast, not just on today's episode, but also long term. So if we can start with you, Miss Paige, and then we can jump over to Mr. Todd.
How you doing? My name is Paige Morris. I'm originally from North Carolina, and I'm right now in Florida. I have been in the crisis line before. I have had a lot of moments to get past, and I would love to get to know you and everybody else and see where it goes. If y'all ever want to email or contact me, contact Kevin Odom. He will give you the information. It's not a problem to have this kind of issue, but you can always get past it. There's always ways to help people in need, and this is one of them.
Well, thanks, Paige. My name's Todd Weatherly. I'm a born and raised North Carolinian myself, and I live in Asheville, North Carolina. I'm a therapeutic consultant and have been for a number of years now, but I got my start in the mental health field. I'm going to date myself here. So my first job out of college in 1994 was working with at-risk kids coming out of the jail system and being in a camp-like environment. And I've been either in education or mental health care and treatment ever since. So that's 30 years now. So at any rate, one thing that I think that you two could probably echo is that people who find themselves in crisis and families that have a loved one that are in crisis end up being in a spot where they don't know where to turn or what to do. And if you're in the treatment or in the professional world, or maybe you've been in the crisis and you've gotten help and you kind of navigated that, being a person that's a resource for people to know where to go and what to do and where to turn and what to say to their loved one and to have hope, just like Paige was talking about, is a big deal. So that's why I do what I do.
I sincerely and humbly appreciate you introducing yourself and sharing with everyone. Before we jump into today's episode, this episode is brought to you by WebHash. WebHash is a sponsor of ours, and we support them also. How come? Right? They are a Web3 technology, basically no code decentralization, building a website platform. You can purchase a domain from somebody like DNS. You connect your DNS domain to WebHash platform, and it turns your website into a NFT, also known as a non-fungible token. We actually have a that we put together for them. Absolutely an amazing organization to support. We have partnered together to make a global impact on the mental health, substance use, suicide, and wellness area around the world. It is very sad to see what is going on in the field. So,
does anyone else have that one tool that makes building a website a breeze? In an era driven by digital change, WebHash is the indispensable tool that holds the key to effortless website creation. Create websites that endure, defy censorship, and bypass any single point of failure. As cutting-edge technology redefines reality, seize the power to build beyond limits. Join the Web3 revolution now and forge paths others can only dream of. Visit our site today and build your legacy. Building my own space on the web was always a grind until I hit up WebHash. Their no-code builder is my ace. It's swift and solid. It's like rocking a digital fortress that's immune to the typical shutdowns. Level up your web presence without stress. Ready to stake your claim in the digital realm? Dive into WebHash today, connect your Web3 wallet, and get started. They have multiple subscription plans, from a free version to a lifetime subscription. Check them out today at webhash.com. Most importantly, they sponsor the One Moment podcast, helping to raise awareness to critical topics in the healthcare field. Our official website was built using the WebHash platform. Throughout the projects that the One Moment movement built on WebHash, they stood behind and supported it all the way. Sign up and start building your website today. Don't forget to visit onemoment.chain.box and subscribe to our social media channels.
You know, Todd, you and I have been following each other a lot on social media. I think I've probably have met with you a time or two in person throughout my time being in the field. I'd like to have you start us off.
Okay. Well, and I would say that I look at what's going on in mental health, and because we spend a topic that's been really important for me, something I've noticed and something that I try to bring awareness around when I speak to groups and things like that is we spend a lot of time, and there's a divide between the two different care environments. So you've got hospitals and community-based or state-funded kind of care, right? Local ACT teams and outpatient centers and hospitals that will bring people in who are in crisis for a few days and then kick them right back out. We see them kind of go in the revolving door. And then you've got the private pay side. The private pay side is for people who've got enough resources to pay for care. And the truth is that we can do really good mental health care in this country and abroad, but we've got programs and professionals out there doing really solid care. I think that, Kevin, we probably reflect on you and your practice. I'm sure that you've been around the block enough and you're able to work with people in a way that makes them feel like they've got hope. But when people are in crisis and they need residential care, being able to pay for it when insurance doesn't cover it gives you a better chance, frankly, of making a successful run than not. There is a little bit of middle territory where you've got addictions programs that have done a lot of work to advocate for insurance coverage, and they've seen gains in that way. They're still observing these kind of, false 30-day treatment period kinds of stuff. So you still see insurance companies trying to dictate what treatment should look like and how long it should be and all those other pieces, or deny people coverage. So you end up being in a fight and trying to advocate for yourself and that sort of thing. But the care quality changes every time you go up that ladder of care. And one of the things that I've been really interested in and trying to bring to the world is I think that we could bridge these things, because if, like, psychiatrists that are in private practice or they serve a hospital, you'll have them and they'll be kind of trying to put together somebody's follow whatever they're going to do after they get discharged, right? And they don't know anything. They know about whatever the hospital's got to offer and maybe the 2 or 3 centers that are down the street, if there are any, depending on where you're at. If you're not in a large city or an urban area, there's not much around. So you're relying on the very limited resources, and they don't even know that the private pay world even exists. And they're a psychiatrist. And so kind of getting these two worlds to know that once one side of the world knows that, oh, wow, 45 days is a minimum length of stay, and this person needs a coach and they need a therapist after they step out, and they need, somebody who cares about them, and they need to follow through with their meetings and so on and so forth. Like, all the things that a person needs to do, if they do it for long enough, they have really successful outcomes. And I think that I think they just don't talk to one another. I think they don't know that this other world exists. And I'm trying to bring them together. I guess the question I have is, Paige, you've got your own personal experience. One Moment does a really great job of bringing awareness, but you've got a lot of credentials. And what do you guys see out there in the world in terms of where it works and where it doesn't, and where the bridges need to be built?
I've seen a lot where people like us see people different because the other people that aren't us, they see us as a problem. But what they don't understand is it's actual sickness and there's nothing they can do about it. And what people need to understand is it's a sickness. It's not just something that you could throw away. It's always going to be there. It's going to be any kind of crisis is going to be there. Everybody has crisis. It doesn't matter what it is, how it is, where it is. People just doesn't understand it until they see it for their own eyes.
That's right.
I think you're right on that one, and I love that you even started on that, because that's a conversation we barely even scratched the surface on a few episodes ago when we spoke about barriers or gaps in mental health and in seeking treatment. I'm a huge research oriented person, and I think anybody who knows me well enough to know that, what does the research say, right? Like, that's going to be my first question. But yet at the same time, research doesn't really go or dig into what we actually experience in the field, right? And so one of the things that, you spoke a lot on quality of care too. I mean, you spoke on a lot. Spoken quality of care. Paige, you and I've had various kind of brief conversations about quality of care and what it's like to treat a person as a person. I've heard so often since I've been in the field, people feel like they're treated as a number and not as a person. And if you look at the website, onemoment.chain.box, it talks a lot about, are you tired of feeling like a number? Do you want to be treated as a person? And that's, look, regardless of pay, regardless of insurance, regardless of background, regardless of diagnoses, regardless of whether it's outpatient, inpatient, residential, state, even corrections hospitals, regardless of all of that, the main thing, and Paige, you and I had a conversation on this about a week or two ago. On previous episode, we spoke about this. Trevor had brought it up, and I think it was me, myself, Miss Tammy, and Trevor. The main thing that I think we continue to miss, and I say we, including myself, as a whole in the healthcare field, is humanism. And I don't mean humanistic theory. The basic humanism that brings us together as a whole, right? My first thing when I'm de-escalating somebody, if I'm ever put in that position, is literally reaching my hand out, shaking their hand and saying, "Hey, my name is Kevin. What is your name?" And it's the basic human touch that helps to de-escalate anybody, right? Not all the time does that work, but that's the basic human approach, human to human interaction. That's the first thing is first that I think we're missing in the whole healthcare field. And then you mentioned it right too. Insurance. They're dictating what is approved versus what's not approved. I remember I was doing my internship and there was a guy that was smoking weed daily. Like, he would smoke almost an ounce of weed a day. He wanted some help, so he went to a residential program. They put everything in the system. He was denied because the insurance said, well, you don't meet criteria for residential. This guy's spending $1,000 a week, maybe more on weed. His life is in complete shambles. And the insurance can't accept it. And so you have those entities, those people making these decisions for people who are struggling and needing help. There's a huge gap. So it goes from the basic human approach to insurance companies, as you saying, they're making these decisions that's completely affecting quality of care and people's chances of wanting to get sober, stay sober, get mentally stable if there's any type of psychiatric stuff. So yeah, there's a huge thing that I have seen and continue to see.
Paige, how about you? Like, what was your experience when you said you were in crisis and looked, you sought help and you got help and that sort of thing? Like, I'm curious what your experience
Okay.
going through that was.
My experience was not very good. I started doing drugs when I was 15. I finally just now got sober. I went to rehab in Florida. I got away from North Carolina, away from the people I was hanging out with. When I was in my crisis, I lost my family. I lost my friends. I was losing money. I lost all hope in myself because some things that had happened. And it's crazy how you have to learn how to get everything back. But it's hard for people to trust you even though you have a mental issue. It's hard for people to trust you because you don't know when they're going to pop off, or a drug addict, you don't know when they're going to want to steal money from you. And it's hard because everybody now looks at me different because I come clean and I told people and I talked to people about my crisis. I've had to come to rehab twice. But I came to rehab for dual diagnosis, for drugs and mentality. I was having mental issues after I got off the drugs because the drugs kind of mess you up.
Yeah.
And it's hard. Kids need to understand that it's okay to be honest and tell the truth. People understand honesty more than lies because they can get help.
Well, and to your point, I think you were talking about this, just treating people as human beings.
Yes.
When people are treated like numbers, what you do is you place a barrier to access. It's just like
Yes.
this insurance company, they're making this decision and suddenly this person's not getting help. And, or you get in front of somebody, you tell them your problems and, the stigma comes up and they dismiss you and they're like, I don't want anything to do with you. And then suddenly, just every time we do that, we deny people access to care and deny people access to getting their life together and making things better. And I was talking to a bunch of folks in the program world on the private pay side, and I said, I know we all struggle with the insurance game and everything else, but don't you think it would be easier just to care for people and give them
Yes.
the help that they need instead of trying to like keep, manage the cost by keeping them at bay? I really think that, maybe there's a bigger initial cost at first, but I think if people got the care that they needed, that you'd save a lot of money because you'd have a community of people that weren't just recycling back through care all the time.
Yes.
And I don't, and maybe you guys see that as well. Like, I don't know if you're, on the end that you're working on, like working with people, whether or not there's probably a story out there where someone, and if they just gotten it the first time, they wouldn't have had the 5 other times that was hard for them. And my experience is I think we're creating a world of people that get far sicker and far more complex.
I definitely agree with that. What is concerning for me when you talk about quality of care in this world is we're getting away from quality of care. And I think y'all both would agree with me. I was reading a research study, it's probably been 6 months ago now or so, but it said over 20% of people, when they have thoughts of suicidal ideations or thoughts of self-harm, over 20% don't disclose this to their medical provider or their therapist. And the reason the reason they don't disclose these things is because um, they have a fear of judgment from the healthcare system. They have a fear of, losing the things they have. They have a fear of judgment from their immediate community and from their family. They have a fear of judgment from their job. They have a fear of being forced by their therapist or their medical provider to an inpatient unit or to a hospital. And they also have a fear of being forced to take medications that, hey, I don't want, and their thoughts is, I don't want medications. I just want therapy. I want help. I am begging and grieving for help. And then there's even more research that shows there's a lack of trust, across the board. And there's so many reasons why. And in that qualitative study, I was reading, a young lady went to a local hospital, and I forget where this research study was at, but she went to a local hospital. It was opioid withdrawals, asking for help. And this was a major research study. Like, it was huge, huge. And I would love to go back and find it again. But they studied it on trust, lack of trust, or how trust affects quality of care. And they found, through this qualitative study, I think it was I think they did about, they interviewed about 6 to 8 patients. But this one lady really stood out. She said, I came here for opioid withdrawals. I asked the doctor about getting Suboxone or Subutex or even methadone, right? Either one of those 3 medications. And the doctor looked at her and said, you're a drug addict. I'm not going to give you anything. You don't need this stuff. And it's like, wow. Like, and she said that she literally did not, that she does not want to go back and receive any help from any healthcare provider based on that one interaction. Those things right there, you talk about quality of care. Trust is a huge, huge, huge factor in that. Going back to the COVID-19 era, I know a lot of perceptions on that, and I'm not trying to get into the political biases here on this one, but a lot of people, they found that a lot of people did not get the COVID vaccine, and the reason being is because of they took it back to the Tuskegee syphilis study and on how everything unfolded under that. So you're absolutely right. Like, quality of care is a huge problem. And if we don't build that trust between us and the community, us and people, we're going to continue to feel this monster, whether we want to or not. You're absolutely right. I've seen that.
Well, it goes the other direction too. There was a study that was done and it talks about, and it was trying to see, they were evaluating different clinical methodologies and, therapy practices and trying to figure out which one was best, right? Is it EMDR? Is it CBT, DBT? Which one of these methods gets the best results? And they found it was less about the method and more about the therapeutic alliance, the trust that the person had with their provider. Like, that was the key factor. And it's like, if you are competent with your method, that's great. If you don't have an alliance, a therapeutic alliance, a trust with the person that you're working with, your results were less. So, I mean,
Right.
Absolutely. Paige.
He's right about it.
you can speak to it, I bet, Paige.
I've had a lot of experiences with it. Yeah. I've got a lot of friends that still go through the problem, and their experience with people basically denying them and rejecting them because they're past and, oh, you're the same as the way you used to be. Okay. You're not taking your meds. Sometimes insurance don't take, so people don't have choices. And a lot of times people, it makes it worse. Yeah, people go to the hospital. I've never had to go to the hospital for my problem. Thank God. People have to go to the hospital because of the problem, yes, but they're not willing to give out the Subutex and the Suboxone and whatever else they use because it is supposedly a man-made drug, the same thing. That's the reason why he didn't want to give it to her. And I understand where he was coming from, but I do understand where she was coming from. I can see 2 sides of the story now, not just one side like I used to. I can actually understand things more now that I've been clean for almost a year.
Congratulations on your year.
Thank you.
Yeah. Congrats. And that's what I feel like needs to be talked about more. When I was going through getting my master's and, of course, working on my PhD, I think you and I probably read the same study, because I remember reading that study where they looked at EMDR, DBT, CBT. There was like 5 or 6 different theoretical modalities within that research that they had looked at to see which one does more. And they found that the therapeutic approach all the time exceeded the results of the approach itself. That regardless of the one thing that produces about at least around a 60% plus more of change in people is that therapeutic rapport. And there's researchers that I really love. Is it Castle, Frankie, and Falcone? I think those are the names. But they looked at the theoretical model of trust building. And I actually, when I was working on my dissertation, I actually used their theory, which one comes first, affect or cognitive trust. But a lot of the stuff that we need, or that a lot of the stuff we're talking about, I think a lot of what they said in their research and their publication really is key to rebuilding the healthcare system. And I shouldn't say rebuild. I think that's a strong word, but I think you get what I'm trying to say, right? The insurance really needs to trust a person more, because if the person knows themselves better than what I do, the person knows themselves better than what any Medicaid company will say or Medicaid company will do. And unfortunately, I've had people where, they will say, "Hey, I want residential," and I look at them and I would have to tell them, "Listen, you don't meet criteria for residential. I can't give you a referral for residential. They're going to deny it, but I can give you a referral to IOP. I can give you a referral to PHP. You might meet criteria there, and this person's begging with tears in their eyes for a referral to a residential treatment program."
Well, you're naming something else there too, is that, and this is part of the game that the insurance companies have stacked on people, but it's, the amount of bad you got to be to qualify to get the amount of help that we know that you need. Like, you've got to get really bad before they're willing to, you've got to get in crisis, and you've got to get so far down the road of not having any help that you don't really have any other choices before you qualify for this level of care, right? And as opposed to a person going, I really think I need residential care because I've got this problem. I've been struggling for a while. Well, there's no evidence. You're not going to meet criteria because, et cetera, because of all these boxes that you're supposed to check off. And so that person, you know, like a lot of people, they don't get as much out of either PHP or IOP, or maybe that's not really the level of care that's going to meet the need, even though the insurance company is saying otherwise. And so all of a sudden they get worse, and then they get worse, and they get in real crisis. And now they're blowing out of something. They've lost their job, they've lost connection with your family, just like your story page, and now they're in such crisis. Yeah, they do meet criteria, but if they had gotten help when they asked for it, the kind that they needed, they wouldn't have had to go down that road. And it's almost like it's stacked against you. And I think a rebuild is not a bad statement, because when they say it's broken, I said, well, I'm just not sure when it was functional. Like, we've got things that do well. We've got some things out there that are doing a good job, but we need a new model. I really believe that.
Imagine a day where fatigue doesn't stand a chance, where clarity perks up your focus as the clock ticks on. Discover W Energy, the drink that transforms ordinary moments into opportunities. With no sugar and flavors that feel like gourmet art, each sip stirs your senses, readying you for greatness. W Energy is a focus energy drink that contains no sugar and is available in a variety of unique flavors. Their coffee fruit cherry extract is the star of the show. This ingredient is what makes W unique and helps to provide smooth and effective focus and energy, making it perfect for anyone who needs to conquer a task. W flavors are created with one goal in mind: to taste unlike any other beverage. We combine bold and unique flavor combinations to craft an experience for your tongue with each sip. W achieves its smooth, effective focus with a high-end tasting experience while using no sugar, no fillers, and no artificial color or dyes. Every product they create follows the same philosophy: be effective, be clean, and taste as good as nature will allow. Use promo code ONEMOMENT to enjoy 10% off their products. And most importantly, they sponsor the One Moment podcast. They are helping to raise awareness of mental health, substance use, suicide, and much more around the world, seeking to make a global impact, reducing stigmas and changing lives one moment at a time. Visit onemoment.chain.box to learn more about our podcast, follow us on our social media channels for more information, and to stay up to date with our episodes.
No, 100%. And it's so sad to see, especially here in North Carolina, where I think we're the only state left. And it sounds like to me you're more knowledgeable with various insurance policies at the state level versus, I am. And I say that respectfully and humbly. But I remember there was a situation that happened, and anytime there's a change in the healthcare system in North Carolina, we're the only state left with the policy that says when Blue Cross Blue Shield makes a change, everybody else falls through, including Medicaid, Medicare, what have you. Or when one insurance makes a change, everybody else falls through, right? We're the only state left out of 49 states. How come we have insurance companies that are dictating care versus other states where you get people who actually dictate their own care. I thought it was supposed to be person-centered treatment, right? That's my question. Carl Rogers would be turning in his grave swayed at this idea that we say we abide by person-centered treatment.
By our own definition, maybe, right?
Right.
We do
Well,
person-centered treatment, but we ignore the person in this person-centered treatment.
Right.
I
Right.
can
You
tell
are.
you, I can tell you one thing. Insurance companies, I wish to help more people. I wish the insurance would be a lot cheaper and would actually take everybody and not deny a lot of people. Because I know a lot of people still to this day that can't go get help for their mental health or substance use. There's a lot of friends of mine that are living on the street because they can't get the help or go get clean. And I'm hoping and praying they change up and start being able to help everybody and not just who they want to help.
Well, it's a fight for sure. I'll say this, just kind of the PSA thing, because we get folks that are kind of in the middle. They got a little money, but they got to use their insurance and they got to fight for every dollar. So we always end up having to like, let's do these tricks. One of the tricks is that if you might be able to get insurance out of the marketplace, but if you've got mental health concerns or addictions concerns, and you need to get real care, you probably want to. Most of those plans don't have out of network benefit, and most places that offer treatment are out of network providers. So you end up not having any choices.
Yeah.
So you can ramp it up a little bit if you got a little bit, or somebody's willing to help you, and you can get a plan like the gold or platinum plans that have an out of network benefit. That's one trick. The
Yeah.
other trick is that when you start to work with an insurance company, if you're trying to get treatment and you're getting the denials, ask for a case manager. The case manager will pick up and you'll have a lot more traction with a case manager who's looking at your case privately, because the first thing that the first thing the insurance company is doing a lot of times is just denying. And most people are
Right.
like, well, I guess they denied it and they go away, and then they don't have to spend any money. You ask for a case manager, they have to look at it. You can do the appeals process and everything else. Those are just a couple of tricks we share with people. But, I think we said something about this early on, like advocate for yourself, man. Speak up. You
Yep.
deserve the care.
No, you're definitely, and I'm gonna touch base back on that one here in a moment. But that shows me that one of the things that you mentioned, I'm sure you've recognized this or realized this, right? But it's sad that private insurance will pay for a treatment program, and I am grateful. So what I'm saying is, I'm not hitting on you, Paige, but this is just an idea, right? Well, private insurance will pay for a treatment program like Paige went through, which is top of the line. I know the program she went through, absolutely amazing program, but yet Medicaid will pay for a state program for 2 weeks.
Right.
See what I'm like? So there's not a and I'm not saying that to knock insurance or knock Medicaid by any means. No, I'm not knocking Medicaid or insurance. I'm just knocking the gaps there, because that's economical differential between those who have private insurance versus those who have Medicaid.
Every time when we've got clients who come in and maybe their loved one has Medicaid, it's like, look, you need to buy them some private insurance because Medicaid doesn't pay for nothing. With mental health, when it comes to mental health care, sometimes with addictions care, but very little with primary mental health care. Very little.
Absolutely. No, 100%. And so, yeah, I think that is a huge gap that I've seen. Even opioid treatment, when I worked in opioid treatment, private insurance was just wanting to keep the pay low. I mean, they would fight for an appeal, for reimbursement. They would fight for a lot of things. Oh, well, we need to see all of these things. Does this person really need your level of care? Do you think they can probably do just outpatient therapy? So I always told people, and this is not saying this to get me in trouble, but this is when you say patient advocate, right? Every time that we would do the annual paperwork, the one question up there on that documentation was, why do you think you should continue treatment for another year? And patients would be like, well, I don't know what to say. And I can't tell you what to say, but listen, I would go into my therapeutic patient advocacy role and be like, Listen, I've had patients, I've always encouraged patients to, maybe think about the chances of them relapsing. And so the patient will say, you know what, Kev, let me write that down. I will, if I will relapse if I don't continue treatment. And if I relapse, I will die. Are you sure you want me to say that? Absolutely. Please write that down. Patient reports they will relapse.
Right,
Right.
right.
And I didn't tell them to say that.
They
I
said
helped
it.
them to, yes, they said it. I helped them to advocate for themselves, and their insurance would, or Medicaid would continue to pay for treatment for the next year. Why even have to go through that? It's that simple. Why? But that goes back into patient advocacy. A lot of patients, we just did a podcast too last Friday with Miss Tammy, and we spoke about a lot of the minorities, LGBTQ population. A lot of people don't feel like they have a voice, and they actually do. It takes us to help them find that voice. And so you talk about self advocacy, that's a huge barrier to receiving treatment.
Yeah. What made the difference for you, Paige? What, like, you got a year under your belt and sounds like you went through a great program. Like where did it start to work for you? Like, what were the tricks that you played? What advice would you give?
I went into rehab last year, but I went to Florida. I had to sign up for my own insurance because my mom's insurance wouldn't cover it. So I had to sign up in my own name for insurance. I will say it gets easier once you open up and try to look for the help and not be scared to voice your opinion is when you're going to actually get somewhere to where you can get the actual help you need. When I was in my addiction part and my mental issues, I went to thinking I was crazy and then starting to save money up and this, that, and the other. Finally, I got to the point to where I was able to do things for myself, and the insurance started helping, but the insurance didn't pay enough. It's still some issues with the insurance. That's a problem, yeah, but it's not something you can't fix. You got to always ask for the help and see if you can find somewhere else that will help you further. People that, okay, for instance, people like I used to be, addicts and mental patients, they automatically stop after they hear you can't. Because sometimes in their mentality, that is a stopping point. It's a breaking point. I can't do this. Yes, you can. You just got to push.
Got to keep going.
Everybody doesn't understand. You have to push yourself to strive better. And when you do that, you can get somewhere. And that's where it landed up with me. I wound up doing everything I needed to. Now I'm here sober and in Florida,
Whereabouts in Florida?
Port St. Lucie.
Okay.
Yeah.
Yeah, there's a
So,
lot of treatment in Florida.
yes, my first rehab I went to last year, I came to Florida. I saw how the other places were treating people. Some rehabs treat you perfect. Some rehabs don't. Even, for instance, for people that have mental issues, like mental patients and drug addicts. I had to do both, not just one.
Go
Everywhere
current.
I went to, they, for instance, they were the worst places I've ever been to. I finally found the right place to go to, and they got me clean, and I was clean, and they told me I needed to come back home and wound up, and now I'm back in Florida.
How did you find the place? How did you find the right place?
Long story short, I was a little high. Don't get me wrong. I was a little high, and I Googled up inpatient treatments, and that was the first one that popped up. So I just went with it.
You lucked in. That's good.
Yes, sir.
Doesn't always work that way, as you know.
Right. Some some actual facilities, they will pay for your flight there.
Yeah.
They'll pay for your stay at the hotel if you have to stay at a hotel for a night. They'll pay for everything until you get to their actual facility. And the facilities are pretty good. Some need work, but they're working on it, and everybody's just nervous to turn to that page. You know what I mean? All the addicts and the clients and stuff like that. Everybody's scared to actually admit that they're an addict or have mental crisis. But it's normal. But people are scared to be normal. People shouldn't be scared to be normal, even going into a rehab. You know what I mean?
Well, admitting it and suffering after suffering that way, I think, is terrifying. I mean,
Yes.
the process of recovery is not for the faint of heart.
I was scared to be judged when I first started. Now I'm willing to talk about everything. So
That's
it's
awesome.
it's a good thing because it helps people out if they talk about it.
Yeah.
And
Well,
if you talk
people get
about it,
worse
you
if
can
they
actually,
isolate.
yeah. If you talk about it, you can actually when you talk about it, you can always have it where people will think about it and then they'll want to go and do it themselves. The more people talk about it.
I got a sticker
So
on my
it's
computer that says community is the intervention and the and the outcome.
right.
Community
But
is the thing.
people shouldn't be scared for this. You know what I mean? And that's what kind of gets to me because kids are scared about I'm dirty and I need help. Mom, I'm having problems with my brain, like mental issues. Come out clean. It's not going to hurt you. Everybody should understand that. And they will understand it once the world comes together and not separate themselves from each other.
But it's normal to be scared too. I tell people that all
Yes.
the time. I mean, it's not like you're getting if you're afraid that's natural. You should be.
Right.
Not saying you should be afraid, but it's a big deal.
Being afraid and having all these emotions is normal. One of the things that I've seen too, getting back to what you were talking about, Paige, getting into treatment, the barriers to treatment, and all of that. A lot of confusion, a lot of fear, a lot of emotions come up, and it's mixed emotions that I've seen. I've had patients who were, when I was working outpatient, I have had individuals, they were so deathly afraid. They were approved for residential stay, but they only trusted us. And they said, "Well, Kev, can y'all please take me over there? Like, I will go if y'all take me over there. I trust y'all. I don't know anybody else." And it's that fear. It's that fear of the unknown, or that
The
lack of
judgment.
trust in somebody. Yes, yes, fear of the judgment, being judged by somebody else because they're maybe because they're an IV user, or maybe because they have HIV. They don't want people to judge them harshly, or judge them at all, and they just want to be treated as a person. So yeah, there's a lot of barriers to, because of those the emotional toll that recovery or substance use can take on somebody.
Absolutely. Well, I've enjoyed being a guest with you, Kev, today and meeting you, Paige. If you get a chance, send a link to that study. I'd love to go look at that. I had not heard about that study you were talking about before. Cognitive or affective, which comes first when a person's doing therapy?
Yeah.
You were talking about. So when you get a chance, and then hopefully we'll get you over onto our show, and I'd love to join you guys again, Paige. Wish you the best of luck. It's nice to meet you. Kev,
Nice to
thank you
meet
so
you.
much for
Thank
the
you.
opportunity. I appreciate it.
Oh yeah,
You're welcome.
absolutely. I appreciate you being willing to come on. Listen, folks, call to action. Okay, a call to action is, you have a voice. All right, speak up. You have a
Hey
voice.
now.
Advocate for yourself. As Mr. Todd said, if you get a denial on any type of health care service that you feel like you absolutely 100% need, use your appeals process. You have a right to appeals.
Back.
Mr. Todd, what is your call to action?
I would echo your call to action, fight back. I'd also say don't give up. Just because if you feel hopeless or you something, like Paige says, get help, find somebody who'll give you help and stick with it. You got to make that decision, but it's worth it. Get out there and find someone who can walk you through it.
How about you, Paige? Your call to action for people.
Don't be scared. You can always try and keep trying until it succeeds.
Absolutely. Well, thank you for the audience. Listen, if you're watching this, check out our webpage, onemoment.chain.box. We have a lot of sponsors up there. We have a lot of resources up there for people. So check out our website. Subscribe to us on YouTube, Instagram, Facebook, LinkedIn, TikTok, Focus, Minds, and X. We are across all major social media platforms.
Have you ever felt like the world would be better off without you? You're not alone. And there's more to this feeling than you might think. New research reveals that suicidal thoughts and behaviors are unique to each individual, challenging the old belief that it's solely due to depression. When people are suicidal, they often believe they are a burden and that their absence would relieve others. They might see suicide as a solution to their overwhelming problems, feeling lost and unloved. But ancient wisdom, like that from the Bhagavad Gita, teaches us to give up selfishness and embrace kindness, respect, and compassion for all. St. Paul once said, "Love never fails," reminding us of the enduring power of love in our lives. No matter where you are in your struggles, remember that someone cares about you, trusts you, and loves you. You are not a burden. Time has a way of healing, and your struggles will pass. Don't give up before the miracle happens. Hold on, because peace and love are within reach. If you need immediate help, please contact local emergency services. Peace and love to all. KO.
Does anyone else have that one tool that makes building a website a breeze? In an era driven by digital change, WebHash is the indispensable tool that holds the key to effortless website creation. Create websites that endure, defy censorship, and bypass any single point of failure. As cutting-edge technology redefines reality, seize the power to build beyond limits. Join the Web3 revolution now and forge paths others can only dream of. Visit our site today and build your legacy. Building my own space on the web was always a grind until I hit up WebHash. Their no-code builder is my ace. It's swift and solid. It's like rocking a digital fortress that's immune to the typical shutdowns. Level up your web presence without stress. Ready to stake your claim in the digital realm? Dive into WebHash today, connect your Web3 wallet, and get started. They have multiple subscription plans, from a free version to a lifetime subscription. Check them out today at webhash.com. Most importantly, they sponsor the One Moment podcast, helping to raise awareness to critical topics in the healthcare field. Our official website was built using the WebHash platform. Throughout the projects that the One Moment movement built on WebHash, they stood behind and supported it all the way. Sign up and start building your website today. Don't forget to visit onemoment.chain.box and subscribe to our social media channels.
Have you ever felt unstoppable, like nothing could stand in your way? Sia's powerful lyrics in Unstoppable and reflections from Narcotics Anonymous is just for today. Inspire us to explore the choices we face in life. Nobody chooses their struggles with mental health or substance use, yet our decisions shape our paths. It's a journey filled with challenges, but also with opportunities for strength and resilience. Recovery is not just about overcoming obstacles, it's about making choices that reflect our inner power and determination. Imagine the impact of your decisions, not just on your life, but on those around you who are battling their own challenges. Every choice we make can either build us up or break us down. What will you choose today? Reflect on the power of your decisions. Each one is a step towards becoming unstoppable. Think about the people who look up to you. Your choices can inspire them to find their own strength. In moments of doubt, remember that resilience is built one decision at a time. Choose to be strong. Take a moment to reflect. What choice will you make today? Will it be one that showcases your unstoppable spirit? Peace and love to all. Remember, your choices define your journey. Stay unstoppable.
In the heart of the city, a vision was born, not just a piece of clothing, but a movement. Vital Apparel reflects not just the raw edge of the streets, but the spirit of innovation to bring about change in mental health worldwide. It's more than a style, it's a statement. A blend of comfort with an attitude made for those who refuse to be average. Embrace the culture, ignite your passion, and wear the revolution. Discover your new favorite piece today and be part of something larger than life. Visit our link now at vtlapparel.com to grab your next outfit. Use promo code OneMoment to get 15% off your order. Why support us? The founders of Vital Apparel, Hung Dao and Alex Kozub, sought out to raise awareness, seeking to change the stigma around mental health. 5% of their profits are donated to Brain Research Foundation, furthering the research in mental health. Vital Apparel sponsors the One Moment podcast. We partnered with one another so that together we can make a global impact on mental health, substance use, and suicide, saving lives one moment at a time around the world. Help us break the stigma. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe now. Some photos in this ad were created by Grok.